the supporters of our meeting is a foundation called the Fetzer Institute, which is an institute that focuses on spiritual issues. And they've funded some research that I conducted in end-of-life care, particularly on interventions, meaning-centered interventions in end-of-life care. And they sponsored, they helped support the plenary session in which we focused on spiritual and existential issues with Dr. Yalom and Dr. Chachnov, and they also helped support us putting on a play at this meeting, a play called Wit, a Pulitzer Prize-winning play about a woman, professor of literature who develops ovarian cancer and confronts death. And so there are institutions and foundations that help support and promote research in this area that I think are particularly helpful, and they're also active in trying to link psychiatric and mental health clinicians, primary care, palliative care clinicians with folks in clergy and chaplaincy.
Dr. Breitbart, I just have one question, additional question I would like to ask you, and this will be the last one. If there is a role for spirituality in treatment of patients, at least in the exchange between therapist and patient, should prayer be considered a therapeutic intervention?
That's an interesting question. Prayer, I think, is often quite therapeutic, and I don't know that prayer is necessarily something that should be prescribed by clinicians. Mm-hmm. But I think that if a psychiatric clinician in getting to know a particular patient learns that prayer is one way and is something that helps a particular patient, then I think that it's not inappropriate for a clinician to explore how prayer helps that patient and to be encouraging of that. I actually have an interesting story that involves prayer in the hospital. About a year ago, I was making rounds with our fellows in the hospital. We were asked to see a young woman, about a 34-year-old woman, who had just had brain surgery. She had a meningioma removed from the left side of her brain. And we were asked to see her because the neurosurgeon was concerned that she had some mild weakness on her right side, and that this was somehow psychogenically produced, because during the surgery, the patient could move her arm and leg, and after the surgery developed some weakness. Despite the fact that the neurosurgeon had operated on exactly the part of the brain that would cause weakness where the patient had it, she was convinced that this was all psychogenic. So we walked in to see this patient, and when we walked into the patient's room, the patient seemed very disappointed that we had entered the room. And I said to her, I asked her, I said, I'm sorry, it looks like you were expecting someone else. She said, yes, I thought my husband was coming in, and I was looking very much forward to seeing him. And I said to her, well, if your husband comes in, we'll leave right away. We won't interfere with your visit. She said, no, you don't understand. My husband is a minister, and the Baptist church, and I was very much looking forward to praying with him. Mm-hmm. So I said, tell me a little bit about praying, about how you pray. So we talked a little bit about prayer, and I asked her how she prays and what she prays for. And interestingly, she doesn't particularly pray to be cured. She prays for strength. She prays for the health of her family. She prays for courage, things like that. And she said that lots of other people pray for her. And we actually had an interesting conversation. I told her that some of the recent literature suggested that it's more effective in terms of medical outcomes when other people pray for you, so-called intercessory prayer, than when you pray for yourself. And she said, well, the entire church community is praying for her. And she then once again said, you know, I really wish I could pray now. And I said to her, well, if you tell us how to do it, we'd be glad to pray with you. She said, would you? And I said, absolutely. So I said, well, you know, direct us, tell us what to do. So she said, well, why don't all of you hold hands and stand around the bed? So we did that. And, she held my hand and she held one of my fellows' hands. There were 7 of us around the room. And then she said, well, one of you should pray out loud and ask, you know, for something. And I said, so I said, okay, I'll pray. And so I basically said, dear Lord, you know, please help our sister, you know, what her name, and please give her strength of heart, strength of body, strength of mind, strength of spirit. And please pay particular attention to the right side of her body, which was weak. And she was extremely grateful. We concluded our conversation. We walked outside. All of my fellows went berserk. I said, what did we just do? We prayed with a patient. I said to them, well, listen, you know, 10, 20 years from now, when you're telling stories about rounding with me, you'll tell the story about the day we prayed with that patient. The next day, we went in to see the patient. And I must tell you, we half expected that her right side would be completely strong again. We walked into the room, and the patient was extremely excited to see us. She said, doctor, you won't believe what happened. And we were expecting to hear her say that she could move her right arm and right leg. And, but that's not what it was. Her right arm and her right leg were still weak. In fact, what happened is she ended up going to a rehab facility for a period of about 4 weeks or so and regained slowly her strength, which was due to the swelling of her brain in the right where she had a surgery. She said to me, you won't believe what happened. I called my husband and I told him what happened yesterday. And everyone in our church community is now talking about what happened yesterday, and they all want to come to Memorial Sloan Kettering Cancer Center because the doctors at Memorial Sloan Kettering pray with you. So.
You have been listening to Shrinkpod, which has been coming to you from the campus of New York Medical College at the Behavioral Health Center of Westchester Medical Center in Valhalla, New York. This program is supported by a grant from the Sidney E. Frank Foundation. I'm Dr. Michael Blumenfield, wishing you a pleasant good day.